Okay, so in this video, we're going to be talking about the glycogen storage diseases. So glycogen storage diseases are a group of autosomal recessive disorders in which there is a defective breakdown of glycogen into glucose. So our liver cells can't break down glycogen into glucose. Now, glycogen is found in the liver and in the muscle, and if you have a defective breakdown of glycogen in the liver, this is going to lead to hypoglycemia because it's the liver's job to maintain glucose levels during times of fasting. And if you have defective glycogen breakdown in the muscle, this is going to lead to muscle weakness because your muscle is going to break down the glycogen into glucose and it's going to use that glucose for energy. So we have four main glycogen storage diseases that we're going to talk about. We have type 1 that's called von Gierke's disease, type 2 that's called Pompe's disease, type 3 is called Cori's disease, and type 5 is called McArdle's disease. So before we could understand the glycogen storage diseases, we need to understand the glycogen breakdown process in more detail. So in our cells, we're going to have stored branch glycogen. So this is going to be found in the liver and in the muscle. Now the branch glycogen, which has alpha-1,6 glycosidic bonds, is going to be broken down into unbranched glycogen by the debranching enzyme. Now the unbranched glycogen, which contains alpha-1,4 glycosidic bonds, is going to be broken down into glucose 1-phosphate by the enzyme glycogen phosphorylase. Now, when we get glucose 1-phosphate, that's going to be converted into glucose 6-phosphate. This glucose 6-phosphate enters the process of glycolysis, so it could be used in glycolysis to make ATP, and this happens in the muscle. Or in the liver, this glucose 6-phosphate can be used to generate glucose in the process of gluconeogenesis, but the liver could also use it in the process of glycolysis as well. Now, the enzyme that is responsible for the conversion of glucose 6-phosphate into glucose is going to be glucose 6-phosphatase, and this is a very important enzyme. Lysosomes could also degrade glycogen as well, and they're going to use an enzyme called alpha-1,4 glucosidase, and it's going to convert unbranched glycogen directly into gluconeogenesis. So these four enzymes that you see here, if you have a deficiency in each one, this is going to lead to a corresponding glycogen storage disease. So if you have a deficiency in glucose 6-phosphatase, you're going to have type 1, and alpha-1,4 glucosidase type 2. Debranching enzyme, if you have a deficiency in debranching enzyme, this is going to be called type 3 glycogen storage disease. And if you have a deficiency in glycogen phosphorylase, this is called type 5 glycogen storage disease. Okay, so we're going to start with the first glycogen storage disease, type 1, and this is also called von Gierke's disease. Now, this is an autosomal recessive disease in which there's a deficiency in the enzyme glucose 6-phosphatase. Now, this enzyme is found in the liver. That means that the liver cannot utilize the glucose 6-phosphate that comes from glycogen breakdown and convert it into glucose. So this is going to lead to a buildup of glucose 6-phosphate inside the liver that's going to lead to a buildup of glycogen. So type 1, or von Gierke's disease, is mainly going to affect the liver. Okay, so now we're going to discuss the first glycogen storage disease, type 1, also known as von Gierke's disease. Okay, so it's going to present in infancy at around 2 to 6 months of age, and the reason for that is that it takes a little bit of time for glycogen to accumulate in the liver and lead to the clinical manifestations. Now, these babies are gonna suffer from severe hypoglycemia in between meals. So they're gonna suffer from lethargy, and hypoglycemia could also cause seizures. These babies could also suffer from lactic acidosis. Now, to understand why type 1 glycogen storage disease causes lactic acidosis, we need to understand the Cori cycle. Okay, so in the Cori cycle, red blood cells and muscles produce lactate. And this lactate is going to make its way all the way to the liver to be converted back into glucose. Now, like we said before, in type 1 glycogen storage disease, the liver is not able to convert the glucose 6-phosphate into glucose. So the last step in the Cori cycle cannot proceed. This is going to lead to the accumulation of lactate in the blood, and this is going to lead to the lactic acidosis that is seen in von Gierke's disease. Okay, on physical examination of these infants, basically there could be an enlarged liver due to the excess glycogen accumulation, and this can lead to liver failure later on in life. Now, muscles are not affected, and there's going to be no signs of muscle weakness. Now, the reason for that is basically when muscles break down glycogen, they're going to use all that glucose 6-phosphate in the process of glycolysis. So muscles do not enter the process of gluconeogenesis. So this means that so the muscles are not going to be affected. Diagnosis and treatment of von Gierke's disease. Now, to diagnose this in infants, basically we usually do genetic testing. Historically, there used to be a liver biopsy used to be done in order to see glycogen deposition inside of the liver. Now, the treatment is going to be cornstarch, which is a glucose polymer, and this is going to be given in between meals to maintain the blood glucose. So we want to prevent these patients from entering a state of hypoglycemia. These patients, of course, are going to have to avoid anything that contains sucrose or lactose. Sucrose contains the monosaccharide fructose, and lactose contains the monosaccharide galactose. And like we're going to discuss in a bit, fructose and galactose can enter the glycolysis pathway, and they could eventually be converted into glycogen. So if these patients take sucrose and lactose, this is going to lead to an increased glycogen deposition inside the liver, and this could accelerate liver damage. Okay, so why should patients with von Gehrig's disease avoid lactose or galactose? Now, lactose, of course, is a disaccharide, and galactose is going to be the monosaccharide. Now, the reason for that is that galactose can be converted all the way to glucose 1-phosphate, and glucose 1-phosphate can be converted into glycogen. So they're going to have to avoid galactose in order to prevent increased glycogen deposition inside the liver, and of course, that's going to accelerate liver damage. Should also avoid anything that contains sucrose, and sucrose is basically the typical table sugar that we consume. And the reason for that is that sucrose contains fructose. Now, fructose can be metabolized to enter the glycolysis pathway, and when it enters the glycolysis pathway as either glyceraldehyde 3-phosphate or dihydroxyacetone phosphate, it can make its way all the way up to glucose 6-phosphate, but it cannot be converted into glucose due to the deficiency in the enzyme glucose 6-phosphatase. So this glucose 6-phosphate that accumulates due to the consumption of fructose is going to be shunted towards glycogen synthesis. And this is going to lead to an increase in glycogen deposition inside the liver that's going to accelerate liver damage. So this is why patients with von Gehrig's disease should avoid anything that contains fructose as well. Okay, so type 2 glycogen storage disease, which is also called Pompe's disease. Now, this is an autosomal recessive disorder in which there's a deficiency in an enzyme called alpha-1,4-glucosidase and alpha-1,6-glucosidase. And these are enzymes that are found inside of lysosomes. So in these patients, they're not going to be able to degrade the glycogen that accumulates inside their lysosomes. So to illustrate this a bit, this is a lysosome, and sometimes lysosomes can accumulate small debris of glycogen. Now, the enzyme that's responsible for the destruction of this glycogen, or the breakdown of this glycogen, is going to be alpha-1,4-glucosidase and alpha-1,6-glucosidase. So if a patient has a deficiency in this enzyme, this is going to lead to accumulation of large amounts of glycogen inside their lysosomes. Okay, so how is this going to present clinically? Well, this usually presents in infants. These infants are going to have no metabolic problems, so they're not going to develop hypoglycemia between meals. And the reason for that is because the glycogen breakdown in the liver is going to be intact. Lysosomes are found everywhere in the body, but the main tissues that are going to be affected by this are going to be muscle. So smooth muscle could be affected, and skeletal muscle could be affected. So this is going to lead to enlarged muscles, so that these patients are going to have cardiomegaly and an enlarged tongue. So these are the obvious things that you could see on clinical examination. These patients could also have glycogen deposition in their skeletal muscle. That's going to lead to hypertonia. They could also present with liver enlargement, but this is mainly going to be due to the heart failure and not due to glycogen deposition inside of the liver. And death from Pompe's disease usually happens due to heart failure. So type 3 glycogen storage disease, which is also called Cori's disease. Now, this is an autosomal recessive disease in which there's going to be a deficiency in the D-branching enzyme. That means that there's going to be a limitation to the ability of cells to break down glycogen. So how does it present? So it's going to be very similar to type 1, which is called the von Gehrig's disease, but there's going to be milder hypoglycemia, and the reason for that is that the process of gluconeogenesis is still intact. So even though basically we have a limitation in breaking down glycogen from the branched form to the unbranched form, the process of gluconeogenesis is still intact. So the process of converting glucose 6-phosphate to glucose is still intact. That's why the hypoglycemia is going to be very mild. There's going to be no lactic acidosis, and the reason for that is that the Cori cycle is still going to be intact. Liver involvement, there's going to be liver and muscle involvement. So there's going to be an enlarged liver, and there's also going to be muscle weakness. Now remember that we said in type 1 glycogen storage disease, it's only going to be liver involvement. In type 2 glycogen storage disease, it's only going to be muscular involvement, but in type 3, it's going to be a combination of both. So the classical clinical presentation is going to be an infant or a child with hypoglycemia and hepatomegaly, and this is going to represent the liver involvement. And this patient could also have hypotonia and weakness and possible cardiomyopathy with hypertrophy, and this is going to represent the muscular weakness. So the key point is that type 3 glycogen storage disease or Cori's disease affects both the liver and the muscles. The less glycogen storage disease that we're going to talk about is called type 5 or McArdle's disease. Now this is an autosomal recessive disease in which there's going to be a deficiency in the enzyme glycogen phosphorylase. Now it's going to be a deficiency in this enzyme that is only found inside the muscle, so only muscles are going to be affected in McArdle's disease. So this presents in adolescence and early adulthood, and the reason for that is that it takes time for glycogen to accumulate in the muscle. So, like we said, glycogen phosphorylase is going to be deficient in skeletal muscle. So all the glycogen that is stored inside the skeletal muscle is going to accumulate over time. So it's going to present in adolescence and early adulthood. These patients are going to suffer from exercise intolerance, fatigue, and cramps. They're going to have poor endurance, muscle swellings, and weakness. They could also have myoglobinuria and CK levels due to breakdown of muscle tissue, and this could be evident as dark urine after exercise in these patients. So just to recap the glycogen storage diseases that we discussed and the organs affected. So type 1 is mainly going to affect the liver, type 2 is going to affect the muscles only, type 3 is going to affect the liver and the muscles, and type 5 is going to affect the muscles only. And that concludes basically this video on glycogen storage diseases.